as we know that Parkinson's has motor symptoms and non-motor symptoms, and very often we do miss non-motor symptoms because they're very subtle sometimes. But it's also been said that non-motor symptoms come very early in the disease, even than the motor symptoms. So it's easy to miss them. But of course, when non-motor symptoms, they come early, so we can definitely diagnose Parkinson's early on the basis of that. So what we're trying to do at my institute, National Neuroscience Institute in Singapore, that we're trying to look for blood biomarkers which are associating with non-motor symptoms. We are on the hypothesis that since non-motor symptoms come early, and if we do find some blood biomarkers that associate with these non-motor symptoms, we can actually try to diagnose Parkinson's early stage. So our study, we are doing basic base level blood biomarkers in all the early PD patients who have just had been diagnosed in the last 2 years, and they are early stages, and we look for all the baseline non-motor symptoms like cognition, anxiety, stress, sleep, everything about the non-motor symptoms. And we're still looking for it, that if there are any blood biomarkers would associate with them, and also we check for the severity of this non-motor symptoms that they're having at that level, at early PD level. There are a few things which are relating with it. For example, for anxiety and for sleep issues, we found that lipid levels, they are a little on the higher side, but that's still a baseline data. So we'll be comparing this baseline data with the later years when patients are progressing into Parkinson's, so that we can look for these symptoms and blood biomarkers earlier. And maybe in the future we'll be able to find some blood biomarker which matches with these non-motor symptoms. Now today I'm presenting my work for the blood biomarkers at the baseline in all early PD patients, but we also, this is a continuing study, it's a longitudinal study. So we're still continuing it, and we're trying to find if there's any association with severity of non-motor symptoms with these blood biomarkers, because few blood biomarkers, they may be more in patients who have more of cognition defects, who have more of sleep defects. So it's an ongoing study, and we have many patients who are in the 7th year of the study, and we're trying to see if the non-motor symptoms, they're progressing, they're getting severe with the disease, and if there is any change in the blood biomarkers for the same. So hopefully we'll get some good results in that and be able to present that later.